Hi everybody, welcome back to Quick Anatomy and Physiology A&P lessons in 5 minutes or less. My name is John Chabelski, and if you're here, I'm assuming that you made it through that first video, so congratulations. Hopefully you took the test. That's located down there in the description there. Probably aced it, and you're here and you're ready to go and you're ready to garner some more knowledge. So without further ado, we got our timer ready to go. So on our marks, get set, go. So today we're going to cover anatomical position and anatomical sections and planes. Our overview, we're going to describe and define anatomical position for you. Then we're going to use directional terms to kind of navigate through anatomical position. We talked about directional terms last time, so as we go through, try to test yourself. Before I say the definition, you kind of say the definition yourself, because we've already talked about it. And then finally, we're going to conclude the video by talking about sections and planes. So what the heck is anatomical position? Anatomists have a general assumption about the way the body is oriented, and this is to appropriately describe where body parts are located in the body. So the assumptions made are that the feet, or that you're standing erect, that the feet are flat on the floor, and that the face and palms are directed forwards. And your arms are down at your sides. So feet flat on the floor, standing erect, arms at the sides, and face and palms directed forwards. That's the general assumption. So let's use these directional terms to kind of navigate through anatomical position. We have the anterior view and the lateral view. Anterior means towards the front of. The nose is on the anterior surface. Posterior means towards the back. The gluteus maximus, or butt, is on the posterior surface of the body. Superior means towards the top, or the top half. So the head is superior to the waist. Opposite superior is inferior. So the foot is inferior to the waist. Kind of similarly related is cephalic and caudal. Cephalic kind of is similar to superior. Cephalic means towards the head. The eyes, nose, and mouth are located cephalically. Kind of similar to inferior is caudal. Caudal means towards the tail, so you can think of your tailbone. The legs, knees, and feet are located caudally. Medial means towards the midline of the body. We have the ulna is on the medial side of the forearm. Lateral is away from the midline of the body, so you have the radius is on the lateral side of the forearm. Proximal means closer or near to a point of attachment or trunk. So we have the femur is proximal to the ankle. It's closer than the ankle is to the trunk. Distal, opposite proximal, is farther away from the point of attachment. So you have the carpals, or wrist, is distal to the humerus. That's the arm bone there. Terms that we didn't discuss last time: ipsilateral. Ipsilateral means on the same side of the body. So we have the liver and appendix are ipsilateral. Contralateral means that they're on opposite sides of the body. So we have the liver, which is over here, is contralateral to the stomach, which is over on the left side there. And finally we have rostral. What rostral means is closer to the forehead and nose. So the prefrontal cortex, which is the forebrain here, is rostral to the cerebellum. And yeah, that's your anatomical position. So let's finish this video off talking about sections and planes. So anatomical planes are imaginary flat surfaces that pass through the body. Differing from anatomical planes are anatomical sections. These are actual real cuts or slices that reveal internal anatomy, but they use the same terminology. So sagittal divides the body into left and right halves. There you have a sagittal section, dividing the brain into left and right halves. Then you have the coronal plane, which divides the body into anterior and posterior. Here's a coronal section dividing the brain into anterior and posterior portions. And finally, you have the transverse plane, which divides the body into superior and inferior. And there is our transverse section there. And there you go. That's our lesson. Went a little over, unfortunately. Sorry about that. But some take-home points. And here is our figures, so I don't get in trouble. Anatomical position. You need to know what anatomical position is, because that is the way that directional terms are utilized, essentially. And finally, the planes are imaginary flat surfaces passing through the body, whereas sections are actual slices or cuts that reveal internal anatomy. So yeah, that's it. Make sure you take the test. It's in the description there. And if you like the video, come back next time, subscribe, hit that like button, and I'll see you soon, okay?